Hey everyone, I'm Gail Trauco and welcome to Healthcare 911. Today we're talking all things health. We're talking obesity and weight loss, and joining me today are Dr. Christine Ren-Fielding and Dr. George Fielding, both from the field of bariatric surgery at NYU. Welcome to the show.
It's great to be here.
Thank you.
Tell me, why do we need bariatric surgery? Who needs it? What does it treat?
Well, I think bariatric surgery is basically the treatment of this very terrible disease of severe obesity. Everyone knows that this is like an epidemic that's on the up and up, and it just doesn't seem to be a lot of ability to deal with it, for people to deal with it on their own. Once you get to be this heavy, it's just so hard.
Give me a weight, give me a pound. Some people use kilograms. Give me a pound. When should a patient think about having bariatric surgery, and why do so few people take advantage of it?
Well, certainly if you're a female or a woman who's 5'5" and 240 pounds or heavier, that's certainly an indication to have surgery, because the statistics is that you have very little chance of losing a significant amount of weight to improve your health and keep it off for many years. And I think that there are several obstacles that prevent people from taking advantage of the innovations that we have in medical technology. This is treatment. This is not experimental, and we have several operations that we'll be talking about, but I think it's fear and not knowing what surgery is all about in order to help a person lose weight.
So if a female patient weighs 240 pounds, 5'5", what about a male patient? What would that weight range be for a man?
So for 6 foot tall, 290 pounds, unless he has diabetes, he has obstructive sleep apnea, if he has high blood pressure, then those medical problems actually make him more of a candidate to have surgery, because the obesity is making him ill.
So when a patient is obese, they increase their likelihood of having concomitant medical illnesses. What are some of those basic illnesses that you're seeing right now in obese patients in the US
So the
population?
worst one we're seeing is diabetes. And as obesity has become increasingly prevalent, diabetes has followed suit. And the problem with diabetes is it just destroys you. And so one of the driving forces behind surgery to treat severe obesity is to reverse the diabetes. And others, as Christine mentioned, sleep apnea is also incredibly common, and it's a dangerous disease. You fall asleep driving, things like that. And the old ones like blood pressure, cholesterol, arthritis, breast cancer as well.
Why is obesity not recognized as a disease?
I think that obesity is looked upon as a personal failing rather than a medical problem or an illness. And it's, again, not understanding why the body cannot self-regulate its weight. Our bodies regulate our temperature, our blood pressure, but it cannot regulate weight. And instead of looking at it as a failure of the body, it's perceived in society as a failure of the mind, not to be able to control yourself.
So would you consider obesity an emotionally related issue, or is it more a physical issue that manifests itself?
I think that's a very complex question, because the manifestations of it are definitely physical. But my own bias after years of doing this is that the disease comes from a physiologic thing. We all eat when we're emotionally upset. You know, if we're sad or angry or we've had a personal loss, we eat. Everyone does. But our bodies defend our weight. So the notion that you can stop your physiology on your own is just laughable, because, you know, and we've all seen this. We weigh 300 pounds, we lose 50 pounds on our own, we're patting ourselves on the back, and the next thing you know, you blink and you put on 60 pounds because your body is saying, you're kidding me. There is no way that you're going to keep that weight off. And then in our environment, we're surrounded by easy access to high calorie food. And so it's very hard and you're hungry all the time, you're surrounded by food, and your physiology is saying, no way. There's no way you're keeping this weight off.
What are the statistics? How many people, what is the likelihood of somebody's going to come to you for consideration of bariatric surgery?
Well, unfortunately, it's dismally low. There are about 100 million people in America that can benefit from having some type of intervention to help them lose weight, but only 1%, maybe 2% of individuals will actually come to have surgery for treatment.
Do you have to have a physician referral to come to a bariatric surgeon for consultation for bariatric surgery?
It is recommended, but I think a lot of people, they actually self-refer themselves because they don't get any guidance from their primary care physician. And interestingly, most doctors don't know anything about how to treat obesity. And so we wind up going to the internet and looking up on their own.
Stay tuned to Healthcare 911, where we cover life-changing topics. We'll be right back.